Good morning, friends and colleagues from around the world. This is Dr. Kianwar Shah. I have in this session with me Dr. Keyvan Javid and Dr. George Freedman for the 2020 Peer-to-Peer Global Interdisciplinary Summit. Dr. Freedman is a mentor to many, many thousands of doctors and has established. Just personally, Dr. Javid is going to read his bio, but from memory, he has participated in over 800 articles, speaks countless languages, has been participant and founder of many other organizations in the industry, personal mentor of mine, and we are very honored to have you here with us today. I'll switch over to Dr. Javid, and I look forward to this presentation.
Yeah, hi everyone. Welcome to the Global Interdisciplinary Summit. It is a huge pleasure to introduce our next speaker, Dr. George Freedman. Dr. George Freedman is the founder and post-president of American Academy of Cosmetic Dentistry, a co-founder of the Canadian Academy of Aesthetic Dentistry, and the International Academy for Dental Facial Aesthetics, and a diplomat and a chair of American Board of Aesthetic Dentistry. He's an adjunct professor of dental medicine, Western University, Pomona, California, a professor and a program director at BPP University London, UK, McClinton program in restorative and cosmetic dentistry. His most recent textbook is Contemporary Aesthetic Dentistry. He's the author or co-author of 14 textbooks, more than 800 dental articles, and numerous webinars, and a team member of Reality and the international editor-in-chief of Dental Tribune. Dr. Freedman received the Irvine Signal Prize at Aesthetic Dentistry, NYU College of Dentistry. He lectures internationally on aesthetic restorative dentistry, adhesion, composites, implants, oral health maintenance, porcelain veneers, 3D printing, and dental technologies. A graduate of McGill University in Montreal, Dr. Freedman is a regent, a fellow of the International Academy of Dental Facial Aesthetics, and maintains a private practice limited to aesthetic dentistry in Toronto, Canada. Welcome, Dr. Freedman.
Thank you very much. First of all, thank you to Kianwar Shah and Keyvan Javid for putting together this excellent international symposium. I'll try to be brief, I'll try to be informative, and we'll start right now. We're going to be taking a look at the things that are really new and interesting in adhesives, in rapid curing lights, which everybody needs, advanced home care, how to keep our work stable in the mouth, single shade composites so we don't have to mess around with different shades and choosing shades, robotic guided preparation for implants, and perhaps for restorative materials as well. That's coming up in the near future. All of this is being organized by GOMHA, the global organization that's bringing you this series of lectures, which is well on track to having 1 million viewers through its 6-week course. Thank you for allowing me to be a part of this. My role is, as was mentioned by Keyvan, I won't go through this again. I'm involved with numerous publications around the world, numerous online, numerous university programs. But if you take a look at the bottom right, where I make my money is on the practice. In the practice, I have to treat patients. So I'm very careful about what I'm doing, how I'm doing it, and what makes sense to me in terms of a private practice. Because if it doesn't pay my way to do all the other things, all the writing, all the teaching that in turn doesn't pay, then it's not going to work. So like that, I'm like all of my colleagues around the world. My most recent textbook is Contemporary Aesthetic Dentistry. You can see it at the top right. If you want to access my articles, the bottom left, you see researchgate.net, and you can access probably about 500 of my articles, and you'll see them. If you want to contact me, f.at.rogers.com. And let's get started with dental implants and the future of dentistry. Dental implants are impacting the workflow. We're seeing less crowns and so on. The European and US market for implants, perhaps not in 2020, but certainly in 2021, will be 4 to 5 billion. The success rate initially is 95% plus. So this is better than most of our other procedures that we do. In the USA, more than 20%, 70 million people are totally edentulous. Think about that. 70 million people are totally edentulous. In the USA, again, there are 18 million bridges placed. That's what happened in 2018. 3.5 million implants were placed for missing teeth in 2018. Now, the question is, why were there 18 million bridges placed and only 3.5 million implants? Well, I think both the public and the dental profession are getting to be more cognizant, more comfortable with implants, and this will change greatly. In the USA, less than 10% of dentists place implants. This is going to change more as they become more confident and more capable of doing this. Well, what's one thing that could really make a major difference? What about robotic implant placement? The NeoSys Yomi gives you the dynamic guidance, real-time visual guidance, physical guidance, real-time patient tracking. So what really happens is that you set up the patient and get a relationship between the patient and the robotic arm. And that's a fairly simple, straightforward device. Through the software, you develop the ideal location in the bone, in the jaws, and for restorative of your implant. The implant is selected, and then the Yomi will guide its placement. It doesn't actually place it, but it only permits precise angulation, precise positioning, precise depth. So if you are angled incorrectly, it won't drill. If you are precise improperly, it will not drill. If you are past your depth, it won't drill. It's a minimally invasive, flapless procedure. You start with the CT scan, and the haptic guidance allows you to do a procedure. Same day planning, same day surgery. It creates the digital workflow in the dental office. You might want to take a look at them for exactly how it works in much greater detail at neosys.com. The product's name is Yomi, and it's a fantastic product. It's going to take the implant world and shake it up tremendously. And not only that, it's going to put the ability of placing implants into the hands of every general practitioner in dentistry. Let's take a look at adhesion. Everybody knows about adhesion. Everybody uses adhesion, and it's something that is part of dentistry. It's been part of dentistry for 40 years in various formats. Now, what comes next? Because we haven't had any major developments in about 18 years or so. If we take a look at the history very briefly, in 1990, the fourth generation of adhesion was introduced. In 1995, the fifth generation was introduced. The difference between fourth and fifth was that you had three components in the fourth generation, two components with a premixed adhesive in the fifth generation. And you can see that on the right side as you're following along. Sixth generation was introduced in 2000, the elimination of the etching step. Now, the etching wasn't eliminated, it simply became included inside one of the restorative components. So you had two components, but no etching in 2000. In 2002, you had seventh generation introduced, and seventh generation you had etching, bonding, priming, everything was included in a single component, and that has been the standard of care since 2002. So this was one component. You can see how we've gone from three or more components to two components without etching, one component for the adhesive, making it very simple, very straightforward, very predictable. And what's next? Well, in 2019, we had eighth generation introduced. Adhesion, 2019, eighth generation. What is it? How does it differentiate it from the others? Well, if we take a look at the inverted pyramid that we have, we go from 3, 2, 2, 1. What will be next? What about no bottles, no components. And that's exactly what 8th generation is. It's the no bottle adhesive. And what we see with 8th generation is that we have a material that's embedded into the composite. There's no separate step, no separate material. The bond to enamel is very good. Bond to dentin is very good, 20 to 30 megapascals. It's moisture independent, no technique sensitivity. And when you're looking for it, you look into that little square area inside the white box. Black center in the white box, you don't see it because there is no bottle. It's included with your restorative material. It's embedded. FitSA is the first 8th generation material from Shofu. It's self-adhesive, flowable, compositive. It's a restorative with Giomer technology, and Giomer, the importance of that will be explained in just a moment. It's truly the better choice, and you'll see why in a moment. Now, is 8th generation far-fetched? Where did it come from? Well, these adhesives have existed for a number of years. We've had one-step resin cements, one-step post and core resins, and they've been with us for 4 or 5 years. The challenge is to insert these adhesives into advanced restorative materials, and this has been achieved. It was actually introduced in late 2019, and these products are now available. It's called FitSA. What is FitSA? Well, it takes the areas of various areas that we're looking for: composite technology, adhesive technology, and bioactive technology. And right in the center, in this area that sort of intersects with all of them, it has a new product called FitSA, which fits all of them. What does FitSA do? It's got Giomer technology, which means it releases and recharges fluoride for the life of the restoration. Instead of fluoride being inside the material once, and then once it's gone, it's gone. Every time you put a fluoride application in the mouth, any fluoride releasing material, it recharges the restorative. And because there's no adhesive barrier, this restorative can now recharge the exposed surface of the tooth that is adjacent to the restorative material, to the FitSA. It is antibacterial and has the effect of neutralizing acids. FitSA eliminates the bonding layer. There is no bonding step. There is no bonding layer. The polymerized bonding layer creates an barrier inhibiting free ion exchange if you have a bonding layer. The bonding layer creates stained line at the margin. But if you don't have a bonding layer, you have no staining. Simple as that. You can't. FitSA is an 8th generation bonding agent. The essence of simplicity. There's no bottle, no etch, no steps, no technique. So you can do it. It's simply included in the restorative material. It's got chemical adhesion to the dentin, micromechanical adhesion to the enamel, bonds to dentin and enamel invisible margins, and you have great aesthetics. You have nano-hybrid aesthetics and strength. You have excellent polishability, long-term durability, and a chameleon effect. So you're taking all these properties that you want to have, and you're putting them all into one area. Indications. Well, the indications include Class 1, they include Class 3, Class 4, and Class 5, also for lining under other restorations. So it's a pretty wide choice of where you can use these materials. Let's go into the maintenance of our restorations, our crowns, our implants. We know that nobody likes to floss. But it's also very important to keep the areas not only interproximally clean, but also the areas at the gingival margins on both the buccal and lingual. Now, the Waterpik water flosser is more effective as an alternate to string flossing for improving health. Studies came out 10 years ago which verified this, and more studies are coming out. In fact, the Waterpik flosser is twice as effective as floss at reducing gingival bleeding, and results are even more dramatic after 30 days. So that's very important. Recently, the Waterpik Sonic Fusion, which combines power toothbrush and the Waterpik, has been introduced, and this is what I use personally. Now, if you take a look at the left, you will see that when you're using a brush, a power brush, circular or any other power brush, to try to clean the stain off this corn, it doesn't work because it doesn't go in between the teeth. But when you're using the water flosser, look at how nicely that cleans it out very, very effectively. Imagine combining that water pick that goes interproximally and at the gingival margins along with a power toothbrush and doing both at the same time. So think about that for a moment. Think of how much easier you make it for your patients to maintain their dentition. When you're looking at the tooth at the gingival margin, you have a whole beehive of plaque and accumulation that occurs there. You've seen it, a lot of your patients, you feel it in your own mouth before you brush. But you as a dentist know how to brush at the gingival margin. A lot of patients aren't quite that adept at this. So the water pick can go in at the buccal and the gingival where the floss and the toothbrush will not, and clean that area out. Now take a look at that area on the left and take a look at it on the right after water flossing. See how much cleaner that surface is. You've eliminated all that debris, all those bacteria, which is great. Now, here we see over here, the brushing penetration basically on the smooth buccal and lingual surfaces of the teeth, but not at the gingival margin underneath the gingiva. The flossing goes interproximally, but also doesn't affect the gingival areas. But the water flosser penetrates just these areas that you need to penetrate to give your entire dentition total health. Water flossing is not an alternative to brushing. It's not an alternative to flossing, but it's an absolutely important, essential additive to the whole process. Now, what about curing lights? We all use curing lights. There's so many curing lights. They're so different. We have to make the right choice. Confused? Well, we all are. What's the best curing light? Who do you trust? We want the smallest, most ergonomic, most advanced, most powerful, most uniform pattern, curing pattern, and the most reliable curing light that we can find. Our objectives are fairly simple. We want predictable polymerization every single time. We want speed, so we're not stuck at the chair with the light being held in our hands forever. And we want curing depth. So if we have a deeper restoration, we can be confident that at the base it's being cured. The Fusion from Dentlight is the new standard. It's the most powerful and dependable curing light that's available. It gives you 3 seconds cure of your typical 2 to 4 millimeter restorative layer. Also can be available as a twin head bulk cure from buccal and lingual, as a caries scanner, as a cancer screening device, and so on. You'll see some of those other options in a moment. Very practical, gives you a lot of freedom. It's very small, light. It's like a thick pen. The charging base is about 1.5 inches or 2.5, 3 centimeters in diameter. Fits in anywhere on your counter. Plug it in. The curing light is always ready. It'll cure for a whole day on a single charge, but I just put it back on the charger in most cases. The power that it gives you is 4,000 milliwatts per centimeter squared. This is more than anything else that's available. It's very versatile because with regular curing lights, as you see on the bottom, it's difficult to access occlusal second and third molars or buccals where you don't have a lot of cheek room. But the Fusion 5 has a lot of freedom. It's got a very small head. It just goes in everywhere. The new Fusion 5 is very practical, very ergonomic. 4,000 milliwatts per centimeter squared, 1 to 3 second cure. The twin head is also an adaptation that allows the curing to be accomplished from both sides of class 2 restoration at the same time, cutting curing time in half. Let's take a look a little bit at the curing power science. The curing lights, you want as much curing power possible and as evenly distributed as possible. And here we see 4 different curing lights. The Fusion is at the top. Now, blue is coldest. Green is next, yellow is better, orange is the best in terms of curing power. If you take a look at the Fusion, that's the only one that has a lot of red power right in the center, evenly distributed. The others aren't evenly distributed and not that strong, and that's right at the tip. What about if you go a little bit further? What if you go 2 millimeters away? Because you can't always reach the composite material, especially in a box of a restoration, a class 2, you can't always reach it. So here we have at 2 millimeters, the Fusion is still curing nicely. The others are dropping off fast. At 4 millimeters, you still have a nice balanced cure. And at 8 millimeters, you still have cure in the Fusion, no cure in any of the others. It's all blank. So if you have to be 8 millimeters away, it's pretty well non-functional. When we take a look at these 4 curing lights, there's only one which has that bright white area that extends 10 millimeters out from the tip, the Fusion light, which will cure to that depth and which will give you secure curing that far away from the tip. The others all just dissipate very quickly. And this has to do with optics. The Fusion 5 twin head, the twin head just exchanges, twists on and off with the regular light, and it splits the beam. So instead of having one 4,000 milliwatt beam, you have two 2,000 milliwatts from each head. A simultaneous buccal and lingual cure, as you can see, eliminates shrinkage, improves marginal adaptation. Light tip composite distance is good at 2 to 8 millimeters because it delivers high power curing with lowest dispersion for faster cure. Don't forget, if you take a look at a restoration and you take a look at how far the composite in the box is from the curing light tip, even if you can get your curing light tip right on the tooth, as you can see in the upper right left image, it's still quite a distance away. If you can't get your curing light tip that close, well, it's a major problem. So here we have a graph of how effective the curing power is at distance. The curing power is on the left and the curing distance is on the bottom. So at 0 millimeters, you have Fusion and Velo at 4,000 milliwatts, more or less. But as we go over to 10 millimeters, then we have everybody dropping off to virtually nothing. The Fusion is still at 2,300 milliwatts per centimeter squared, which is still a very effective cure, more than most on the market. There are add-on functions for the Fusion 5. It's much more than just curing light. You have cancer screening. This is all with different heads. The base, the battery, all stay the same. You just change the head. For cancer screening, for caries detection, the twin head, plus curing, and cold laser soft tissue healing. All of these are available at Dentlight. Let's take a look at our composites. A new composite was introduced about a year ago, which really simplified inventory management, incidental composite shades, reduction of wastage, simplified stocking, and for the first time, the restoration matched the tooth color both before and after shading, before and after bleaching, without having to be changed. If we take a look at traditional shade matching systems with different materials, then the multi-layer systems have 36, 34 components. The one-layer systems have 20 or 18 or 33 colors. This is really complicated and involves a lot of storage. They all rely on the chemical color of added dyes and pigments to give the coloration. And traditional composite shade matching it depends. If you have an A1 in an A1 tooth, you get a good match, as you see on the top left. But if you have an A1 restoration, in an A4 tooth, it's a poor color match and it'll be readily visible. Here we're looking at some denture teeth, which are C1, C2, C3, and C4. They're all restored with the C3. The C3 looks pretty well color matched. The other ones are readily visible and readily seen to be incorrect in terms of shading. Omnichroma is the first structural color composite in composite dentistry. No added dyes or pigments. The fillers themselves generate a red to yellow structural color, which combines with the color of the surrounding tooth to give a chameleon-like effect, and it takes the color from the surrounding tooth structure. Instead of having to create the shade is created for you. And if you have an A1 and you put the Omnichroma in, the restoration will look A1. If you have an A4, it'll look like an A4. And you can see this in the 3 teeth at the bottom, where the A1 and the A4 have the same color restoration placed, and they both color match. Isn't that amazing? In fact, if you go across the entire shade from A1 to D4 and you create cavities, you can use a single color, which is incorrect, or you can use a light curing, and you can see that the Omnichroma matches every single color, simply because the color is created by the tooth, not by the restoration. The filler in Omnichroma is a uniform size supra nano spherical filler. It's a round shaped composite. Monomers are UDMA and Tegma. Filler loading 79% by weight, which is very, very high. It will give you a very strong material. The same properties as you get with Esolite and the same polishability that you get with Esolite. They also, let's say you have a very dark tooth, endodontally treated or for some other reason, there's an Omnichroma blocker for large class 3s, class 4s, where the surrounding dentition is different color, or you're worried about the show through from the dark internal part of the mouth. The Omnichroma blocker in a very thin layer reduces shade matching interference. The blocker masks the staining and reconstructs a highly opaque tooth. You cover that with regular Omnichroma shades, and then there are no problems. You can match every single time. Here we have some cases, and you can see various cases. You can see how nicely they match in every single application. This is really very easy because you don't have to worry about the color, you don't have to worry about shading, you don't have to worry about background color, you don't have to worry about incident lights, what clothes the patient is wearing. Just keep doing your Omnichroma one shade. The Esolite Universal Flow has an average particle size of 200 nanometers. The spherical fillers are the foundation for simple, beautiful restorations. Shade blendability: one composite shade can invisibly blend with several tooth shades, but not as good as the Omnichroma. However, still have really, really good blending, and you can see that in the restoration. Now, let's go to Hygiene. BioLace has developed a new hygiene laser called the Epic Hygiene. It's by hygienists for hygienists, pre-programmed procedures, great for pocket therapy, periodontal management, excellent for aphthous and herpetic management, and of course hemostasis. The Epic is easy to use. It's got an intuitive interface for easy procedure selection with a customized handpiece, very reliable. It's got proven technology and built to last, excellent construction, designed for use every day with every patient. Great battery life, 8 hours of usage on a single charge, so you can use it all day on a single overnight charge. And it's got 980 nanometers wavelength, 10 watts peak power in super pulse mode, but most hygienists will not use that amount. Multiple power settings, continuous wave, and comfort plus. There are clear and defined protocols for the hygienist or for the dentist, so you can see exactly what to use, how to use it, and this takes away any questions that you might have in terms of what settings do I have? In fact, the settings are much easier than that. You can actually create a flowchart for laser diode periodontal management, which makes it very easy for the hygienist to create a whole management package. And this management package will guide them to treating every single patient properly, and will develop the codes, as you can see at the bottom in the black, for the billing for these procedures as well. So the EPIC laser from BioLase is advancing dentistry, advancing hygiene, definitely worth looking at. Let's take a look at impressions techniques and what's new. 80% of people, dentists, are still using traditional impression techniques. It's going to switch over to digital or scanned impressions, of course, but that's going to take some time. So we still have to have some good techniques, some good materials. Retraction cord is something I've never liked. It's time intensive, technique sensitive. And I don't know about you, but I've always managed every single time that I finally get it all around the tooth, just as I'm about to tuck the last little bit in, the first little bit that I placed comes out. I don't know if cord doesn't like me or that's just some property that it has, but I've never liked retraction cord. It's very time intensive, as I said, technique sensitive. If it's pushed in hard enough, and that can occur, or if several cords are used in various techniques, that can damage the periodontal ligament. If you impregnate them with ferric sulfates, that will interfere with polymerization. The sulfates, not the ferric part, but the sulfates do interfere with polyvinyl setting. So you'll get a great impression everywhere except the margins where you need it most. Centrix has come out with a product that's very aptly named No Cord VPS, No Cord Vinyl Impression Material. It's faster, easier. It's impregnated with alum, and it's very cost efficient. Alum impregnated means that this will not affect any impression that you take. And it's a familiar technique, no cord. There's gentle gingival displacement. You don't jam anything into the sulcus, but as the alum absorbs the moisture, it draws down the impression material into the sulcus, creating a great impression. And it's very gentle, faster, easier, better. And what better way than to show an example? And you can see over here just how excellent these impressions are, how clear. Your lab will have absolutely no problems with this, and they'll thank you for doing these impressions like that. Real time to take an impression. This is something that is practice management. Let's take a look at many materials. Total impression time is retraction, hemostasis, and material set time. So if we look at that, if you see the various materials that are listed over there, you have to do the retraction, you have to do the hemostasis, you have to do the impression time. Even with the rapid impression materials, there's quite a long process. Now, with no cord impression material, it integrates 3 steps into one. The retraction, the hemostasis, and the impression are all done just in the impression time. So the no cord impression is faster than fast set. Eliminates 2 steps, neither of which are particularly friendly, the retraction and the hemostasis, and just has a shortened impression time. They have a fast set material as well, which is extremely convenient. Definitely something you should look into. You can use it with a cord, of course, but there's no reason to use it. It's safer, easier, better. And models are scannable for easy digitization. Another product from the folks at Centrix is their Fluoridose, and this is a great way to recharge your Giomer materials. It's fluoride varnish, which you put into the or on the teeth, increases the fluoride, and with a 5% fluoride solution or gel, and it pushes the fluoride ions into the restoration and hence into the tooth if you have the right restorative material. The fluoridose is a unit dose, hard setting material. One simple sealed package has a single dose of fluoridose plus one bendable brush applicator, so you don't have to start looking around for different things. You just have everything that you need all together. It dries in seconds on saliva contact, so you don't have to wait around for several minutes. The hygiene chair while it hardens, and it dries to an extremely ultra-thin clear shade. It's not a yellow shade or white shade that the patient will be uncomfortable wearing in public. This just dries on the teeth, totally invisible, remains on the tooth 6 to 8 hours, which is the optimum time for fluoride uptake. And it's a single-step brush-on procedure that is easier and safer to use than gels or rinses. Anybody who's ever had a child rinse with a fluoride solution and has had to clean up the mess afterwards knows exactly what I mean. They also have a post material, which is very nice, a one-step post and core called Encore DC, and it's an excellent material. You build up the post and core, just isolate it or get it so that you don't have material that's seepage of fluids, saliva, and so on into the area, and you now have the ability to build this up immediately, one step, be ready for a crown preparation, perhaps at the same appointment. It's the Encore DC mini mix, and these come in their individual containers so that you use one per patient. No worries about mixing, no worries about contamination. In short, no worries. So hopefully I'm making up for a little bit of the time that the colleague before me took up. I'm at the end of my presentation, and I'm happy to discuss any questions that you might have. Thank you very much. Thank you for offering me the opportunity to be part of this, and thank you to Kianor for having put together the 100 top dentists worldwide, which is a wonderful organization. Thank you.
And so, yes, we have some questions we want to ask you here. Let me start with the first question. The first question is on the robotic surgery called YOMI, right?
YOMI, Y-O-M-I.
YOMI, yes. And so you can plan and treat on the same day, right? And so what do you need?
Sorry.
Do we need a digital impression?
You need, hold on a second. Sorry. Sorry. The way you need, what you need for this is you need a digital impression, a scanned impression, either the scan of the, let me just actually bring you over here so that I can see you and be looking at you as I answer these questions.
Sure.
There we go. That way I don't have to look at the side. Okay, so what we have, what you need is a scanned impression and a CBCT.
Okay.
You need the opponent and the bite scanned as well. So you have to have a three-dimensional relationship, CBCT to show where the bones, the nerves, and so on are. The software develops the location depending on the implant that you've selected, size and shape. And then once that's done, then you have, it chooses the best path for you to do it. Now, once it chooses the best path for you to do it, there's a fiducial, which is basically a set point that you fixate the patient's mouth.
Right.
And so that gives you a three-dimensional anchor point, if you'd like. And then there's you have your handpiece over here, and your handpiece is inside the YOMI arm.
Okay.
Now, the YOMI has decided that this is the proper direction to go. If you're going in this direction, it'll work. If you're a little bit off, it won't. As soon as you get into this position, you get a little haptic feedback,
Right.
a little buzz, and you know that you're in the right position, and you get closer to the tooth. If you're not at the right spot on the tooth, it'll say, no, can't do it. You have to do it here. And when you reposition it over here, you're at the right spot, you go in. When you've gone into the proper depth over here, let's see, when you've gone into the proper depth and you want to go more, it won't let you. The robotic arm basically constrains that the only place that you can go is exactly where you're supposed to go.
Well, that's an amazing technology. And they figured out, so it's small enough to actually fit in the patient mouth with the handpiece and all that.
It's basically a regular handpiece,
right?
Well, a specific kind of a handpiece that's being held by an arm.
Got it.
And you guide the handpiece. So there's an arm over here. Oh, I have to get that. There's an arm that holds the handpiece, and you guide the handpiece over here.
I see.
So it's like having, imagine a slightly bigger suction device,
right?
But attached to a lot of electronics.
Got it. Well, that's amazing technology. That's amazing technology.
It is.
Yeah, that's great. So we have another question. Is on the 8th generation bond you were talking about, and they basically wanted to know, are these 8th generation bonds, are they like one step? They have, the primer, the etchant, and the bonding, everything together, or is it just a bond by itself?
Well, they're actually a no step.
Okay.
So you don't see a bottle. There is no bottle, and there's nothing you have to do. The primer, the etch, or the etch, primer, and adhesive are in the restorative material.
Oh, wow.
So basically, everything you knew about bonding materials, just check out, and you don't have that step anymore. It's gone.
Wow, it's amazing.
One of the reasons that, we've had this technology for years, but you have to realize that the adhesive market worldwide is about $650 million. So
wow.
Very few companies were eager to get rid of that market. But now that the cat's out of the bag,
right.
Now you have some companies who claim, oh, we have an 8th generation. But if you can see the bottle, if they say, well, there's this one bottle 8th generation, it's not 8th generation. That's simply another product that's being called 8th generation. If you have two bottles and say, oh, this is 8th generation because, of some strange reason, that's not 8th generation. If you can see the bottle, it's not 8th generation. The only true 8th generation is when the adhesive and the whole adhesive process is embedded into the restorative material.
Wow, that's amazing. I have another question here. They're asking if the links for the product that you spoke about, are they available? Can you share those with us on the Global Implantology Summit?
Yes. I believe Neosis, Yomi is neosis.com, neocis.com.
Okay.
Dentlight, the curing company, is dentlight.com.
Okay.
The adhesive is at Shofu USA, SHOFU USA.com.
Okay.
And the impression materials is at Centrix, CENTRIX.com.
Perfect.
Did I forget anything?
No, looks like it. Looks like it. Yeah, it was the BioLace, right?
The BioLace. It's also biolase.com, BIOLASE.com. I'm pretty sure. But if you hit BioLace and you put enter, it'll find it for you.
Perfect. Yeah, we'll try to get those links and add it to our website, so that way, if doctors want to get more information, they can actually go ahead and follow that through. There's one more question. It's about the Fusion twin light head, and I think that's a wonderful concept. Like sometimes we do that. We use multiple lights to reduce shrinkage, but this light does it does cancer detection and curves detection. Is that like different heads, or use the same heads? that they're using? The same device does everything at the same time?
Well, no, with the twin head, it's the
Right.
same device. You just change the head. You slip off the regular curing head, like this. You slip it off, and you put on the dual cure head, like that. Okay?
All right.
And then you go in, you adjust the angulation so you're getting the right angulation, and you use it.
Got it.
And then when you're finished with it, you just simply pull it off and put back the regular curing head or cancer detection device or anything like that.
I see. And then there's one last question regarding the diode laser. They're asking, the doctor's asking if there needs to be a certification or licensing for people who use this diode laser.
It depends on which country and which state you're in.
Okay.
There are training courses online, but each country and each state has to figure out whether they can use it without any credits. And I think in most cases in the United States, Canada, and most of Europe, you can. And for the hygienists, it depends on local laws in various countries and states. So you have to check up on that yourself. In the United States, you have 50 states and 51 rules. So
yes, for sure. For sure. Dr. Freedman, last question here again. This is regarding the Yomi, and wanted to know if there's a training on there. Is that something that they have courses on there? That
yes, they have courses that are available online. Every couple of days, there are new courses. Most of them are clinical courses where you're actually sitting in on somebody and watching them perform the whole procedure. So if you go on their website and look for clinical courses, you'll find it. If you buy a unit, they actually send somebody into your office to train you for quite a few days.
That's amazing. That's amazing. Well, thank you so much, Dr. Freedman.
Thank you.
It was a very informative webinar, and it was a pleasure to have you on, Dr. Shah.
Likewise.
Thank you so much.
Thank you very much, and thanks for all your efforts.
And we really thank you for your contribution to this, as many of our colleagues don't have the finances, the ability to travel, or actually gain access to this wealth of knowledge that we're trying to facilitate for them. But thank you guys very much, and thank you for
today, none of us can travel.
None of us can travel, yeah. But there is some distant doctors that not only can't travel, but those also don't have the finances to hear from all of the leaders and world-renowned speakers that can give them guidance to their practices, which knowledge is wealth and power, as you know, and we want to extend that power. As the more knowledge there is out there, the less the silent epidemic is going to be making its ways into our communities.
Thank you for sharing.
Thank
you, gentlemen. Have a nice day.
Bye.
Wonderful day.